Hello, everyone. I hope you can hear me. Thank you very much, Kevins. That's an awesome introduction. I was wondering who that is you're speaking about. So, but very happy to be here today. I have very little time to do this, so I would just like to go straight into it. I have with me three awesome personalities, three awesome, lovely practitioners, experts, three ladies. And I would not do them justice by a long introduction. I'll just mention them by name and then I'll ask them each to introduce themselves. That's Dr. Ayat, Abu Agla, Sachi, Dalal, and Valeria Esquivel. So welcome, ladies. Welcome to the conversation. Really, really happy to have you on board. If I might mention the care economy, to be honest, I learned about the care economy very recently. I've been engaging with the care economy without actually knowing it. So I think the most important thing for us as young people is to even understand what the care economy is, even as we understand a little bit about you. So I would maybe ask Dr. Abu if we could start with you, just give Dr. Ayat, sorry, if we could just start a small introduction of yourself and what you do and what's the care economy for you. We would love to hear from you. So take it over, Dr. Ayat. Oh, I think we've lost Dr. Ayat. Okay. Oh dear. All right. No problem. Sachi, maybe you could go next. Just a small introduction of yourself, who you are, and what's the care economy like for you.
Hi everyone. Thank you so much for having me here. So I'm Sachi, and I am currently working as the Chief Strategy Officer at a tech nonprofit startup in India called Khushi Baby. And what we are doing is creating technology to facilitate rural public health. And we particularly work mainly in Rajasthan, but are working to scale up our technology solutions across India. And our direct relation with the care economy is that we create these solutions, particularly we're creating mobile health solutions for India's largest community health workforce. And what we have is these digital tools that financially and clinically and empower community health workers who work in these villages and serve as healthcare navigators for 70% of India, which is rural. So that's just a quick introduction. Yeah.
Awesome. Thank you very much. I will come back to you in a few minutes. Very interesting. Valeria.
Yes. Shall I introduce myself and also define what I think it is the care economy? So I'm Valeria.
Exactly. Yes,
I am Valeria Esquivel. I work at the International Labour Organization, and I'm one of the authors of the ILO report on care jobs and care work. So for us, the care economy is several things, but basically it is the sum of all the unpaid care work that is done in the households, plus all the work and workers that contribute to the health sector, to the education sector, and to domestic work. So for us, that is all the care economy. And as you see, there is a paid section and an unpaid section. And there are common issues, and there are things that are different and should be treated different. The common issues is that both care in the unpaid and the paid is highly feminized. It is the women who provide 3/4 of all unpaid care work, and it is also in the care economy, in the paid section, in the sectors, that they are between 60 and 70% of the workers, yeah, and depending on the countries and depending on also the sector. So the care economy is huge, and it is a strong employer. And if anyone doubted what the care economy, or whether the care economy was important before COVID, now no one doubts it.
It's very
Thank
true.
you. We'll stop there. We can follow up afterwards.
Awesome. Thank you very much, Valeria. I think we have Dr. Ayat back. Welcome back. Yeah, go ahead.
Thank you, Lloyd, and thank you, colleagues, and good morning, good day, and good afternoon to everyone.
Oh dear, oh dear, oh dear, oh dear. It happens all the time. It happens all the time, I'm sure. Oh, there she is again. No problem, no problem. Maybe as she comes back, maybe I can go back to you, Sachi. You did mention Kuchi babies, I think you mentioned. Maybe you could just tell us a little bit more about the work that you do in India, about you know, your experience within the care economy, and just a little bit more with a bit of a reflection on the current and what the future looks like.
So there's a lot to talk about in terms of like the work we do, but I wanted to highlight two elements of the care economy which has stood out to us. So one is working with the community health workers who are all female, and the nurses who are also all female. So we work with these two large workforces that provide 70% of care to rural India. And then thirdly, since we focus on reproductive and child health, we also interact with all of the mothers who are living in these communities. And here you kind of see this element of unpaid work that is done by the mothers at home and what the effects are on their lives. And then you see the sort of ecosystem in which the female community health workers are living in. And what I wanted to highlight is that on the community health worker side, what we've seen is that the environment in which they work is very, very difficult. They are often quite underpaid. They have huge amounts of work to do and very little time, and it creates a lot of pressure on them, which often leads to them sometimes taking shortcuts. And there's a loss of accountability at the last mile because you have. In fact, I feel like the root cause is just because they are just so overburdened and they're also not skilled enough. So I think the resources into not just the compensation that they receive, but also in terms of the skill set which is imparted onto them when they are onboarded is really important. And that wholly, if the environment in which they are working in is improved, I think that the quality of care that the rural beneficiaries receive will improve a lot as well. And then on the side of the mothers that we interact with, who are our patients, they 99% of them are working in the home and doing like unpaid domestic work or unpaid agricultural. They work in the agricultural fields, but mostly they're just in the household. And what we've seen is that this is not only a barrier for them to enter into the paid workforce, but we also see that this is a barrier for them to receive healthcare, because often like just going to the primary health center and taking their child to a vaccination camp is often a huge burden because they have so much work in the house and they just don't have any help to assist them. So I'll stop there to give Dr. Ayat chance.
Thank you very much, Sachi. Dr. Ayat, go ahead. Welcome.
Sorry for that earlier. We've been teleworking for the past now 2 years, yet we still face internet problems and connection issues. So it's a pleasure being with you all here. And I'm connecting from the World Health Organization, the HQ here in Geneva, where I work at the Health Workforce Department as part of the Working for Health program that works in creating a case that investing in health workforce is indeed investing in health, and also with the Global Health Workforce Network, which among many hubs, we have the Youth Hub that constitutes 500 plus members and 40 plus organizations and unions and associations in medical and health professionals. So it's a pleasure being with you all here. And Sachi, just continuing from what you were saying, indeed, the youth and with the audience here, you know that they represent 1/5 of the global population, yet they make up 1/3 of the total unemployed global workforce, and 145 million work in poverty, where 267 million number of the young people who are not in employment, in education, nor in training. And with the pandemic that has hit the globe, unfortunately, we see the need to invest in health and care workers, especially in the generation, the future and the present, which are the audience among us now, the youth, where the WHO estimates that a shortage of 18 million is needed if we were to achieve the universal health coverage. And just speaking to the point, Sachi, that you just mentioned on how women form 70% of the health and care sector, yet half of it is unpaid care, where estimates show that it ranges up to $3 trillion US. So yes, indeed, these are the figures. Giving a landscape and setting the scene for the discussion. That the figures are real and they're all estimates and projections. And indeed, a lot has to be done, hopefully, within our discussion today, within the Youth Summit, within the organization and institutions and the audience that are here, in order to make the argument that investing in health and care, among other sectors, investing in youth, is the future. So over to you, Lloyd.
Thank you, Dr. Ayat. That's amazing. It's shocking, but at the same time revealing and encouraging that there's so much opportunity. Valeria, you've been mentioned a little bit as the ILO and some of the documents I've read does talk a little bit about and a lot about what the ILO does. Maybe you would have something else to add?
Yeah, thank you, Lloyd. No, I wanted to follow up on Dr. Ayat, and indeed, the ILO and the WHO work hand in hand on supporting investments in the care workforce. As I said before, it is health, but it's also education and it's also domestic work, the broad picture of the paid employment. But I wanted to give you these figures. In 2019, that is before the pandemic, 15% of all young people between 15 and 24 were employed in, of all young female people were employed in the care economy, as opposed to 4%. So these sectors are really strong employers of young women, but they have to have the qualifications for entering these sectors, as Dr. Ayat has said, because both in education and health, these sectors require higher skills and higher qualifications. The other thing to say is that these figures must have increased last year because all other sectors contracted and these sectors didn't. So we don't have the latest figures yet, but we will have them. but we expect this proportion to have increased. So on top of the long-term trends in which we know that there are unmet demands today of care, and there will be greater demands unmet in the future by 2030, in 10 years, in less than 10 years, we also know that the COVID has emphasized the need for investments in these sectors, and therefore the need to or the possibility of creating decent jobs for young people. Thank you.
That's awesome, Valeria. I recently came into contact with palliative care nurses at a hospice, and I became very concerned at how much work there is to do, but how little skill there is to actually do the work, and how little investment there is by government in this space. Maybe very briefly, I don't know what the WHO, maybe what's your experience? I don't know, the ILO. Perhaps this is a conversation to continue into the breakout. That's a very important conversation. But I would probably want to hear just very briefly, what do you think about, how much investment has been made? I know Valeria has talked about trends. Just as we conclude very briefly, Sachi, Dr. Ayat, Valeria, just very briefly, in terms of investments, do you think has been made or could be made?
Well, to me, the long-term care and the early childhood education are the sectors that require more investment as compared to, let's say, education, primary, secondary education, and health. Yet, we know that we are not yet in track to meet the SDGs by 2030. So more investment is required. But it has to be investment that creates decent jobs. These sectors are very labor intensive, and the temptation to create not so good jobs to meet the needs, the way Sachi was describing, is huge. So the important thing is to move to investments in the sectors, and as WHO says, in the care workforce and in the education workforce, but also do it in a decent way, which means paying decent wages and giving social protection. I'll stop there.
Okay. Thank you very much. Sachi, just very briefly before we go.
Yeah, I completely agree. I think investing in not just the compensation of, let's say, community health workers that we work with, but also ensuring that they have the most advanced tools to do their job in the most efficient way and in the most informed way. You can't expect them to do the best work that they can when they're in the dark, and they have to use tools that take so long to sort of work through. But since we have less time, I will stop and allow Dr. Ayat to continue.
Yes, Dr. Ayat.
Yes, just a final sentence. Protect, invest together. That's the slogan of the campaign of the year of the health and care worker that WHO launched. So it sums what we've been discussing. Let's protect our health workers with decent work conditions, environment, decent pay, salaries, education, training, personal protective equipment, and so forth. Let's invest, because when it comes to health, there's always a scarcity in resources. And when it comes to health workforce, they're always left behind. And let's work together, not health sector, but all different stakeholders, sectors throughout the interdisciplinary approach and multi-stakeholders that we have in order to reach that together. Thank you. Over to you, Lloyd.
Thank you very much. I just would like to invite the audience to the breakout session. Bring your pen and paper, bring your most critical mind, bring your innovation space. Let's see you there. Over to you, Mike. Thank you.